Hello. I'd like to thank the British Journal of Urology International for inviting myself and Stacey Loeb to contribute to this month's Article of the Month. Global usage of social media has exploded over the last several years. Facebook and YouTube has over 2 billion monthly users, Instagram an additional billion users, and Twitter and LinkedIn also have a lot of users at 300 million per month. This social media revolution has expanded into healthcare, with urology being on the forefront of using many of these platforms as a global exchange of ideas and a tool for networking. However, despite enthusiasm for social media, barriers exist to use due to a lack of clarity of professional guidelines surrounding engaging appropriately online. The purpose of this review is to summarize 3 major social media guidelines in urology, which is an important part of urology education as social media use continues to expand. Now we will highlight 10 guidelines for use of social media. First, be professional and identify with the code of ethics and conduct as outlined by professional societies. Protect confidentiality and patient privacy, as this is an ethical duty of physicians at all times, regardless of whether the content is online or not. Assume permanence and always consider that your content will likely exist online forever. A pause before you post rule has emerged in many recommendations to remind users to take a moment to remember the time-stamped permanence of all social media interactions. If you're posting as a doctor, you should identify yourself, as there's a level of trust that is given to physicians and clarity should be used when posting as such. Be courteous. Disagreements online are common, so being courteous and not posting in anger are key to encouraging constructive debate and conversations. Avoid providing medical advice and maintain boundaries between you and your potential patients. Although direct patient advice is discouraged, general educational health and academic discourse is encouraged. Be aware of social media policies set forth by employers. Stating all views are your own can be helpful in this regard. Avoid impropriety and disclose potential conflicts of interest. Social media can have a strong influence on potential patients, and thus is it important to be transparent in how you present yourself. Always strive for accuracy and truth, a principle that should hold true in all aspects of a physician's professional life. And finally, understand how other users behave online before interacting on social media, to learn the etiquette of each platform prior to engaging in use. The General Medical Council in the UK, the AMA in the United States, and a few other select medical societies have guidelines for social media use. However, urologists will continue to be leaders in using social media for meaningful professional ways. We hope you will find these guidelines helpful and reference them before you engage online in social media. Thank you.